Now, the Director General of Budget Office of the Federation, Ben Akubreze, has noted that the federal government is making effort to develop a strong immunization system, ensure supply of safe food, water and protection of health workers. According to him, this is due to the fact that the outbreak of the COVID-19 virus has led to the global disruption of people's lives and businesses. Ben Akubreze disclosed this on Thursday in Abuja during a high-level advocacy meeting. Maliki Duro reports.
The Nigeria Health Watch and Nigeria Center for Disease Control on Thursday organized a high-level advocacy meeting with heads of department and advocacy for funding of the National Action Plan for Health Security in Nigeria. The Director General Budget Office of the Federation, Ben Akubreze, who was represented by Alfred Oko, noted that the federal government is making efforts to develop a strong immunization system, ensure supply of safe food, water and protection of health workers.
Levels to improve allocative efficiency, I think I've mentioned it a couple of times, for health sector expenditures, while improving transparency and accountability framework for allocated funds, allocated health sector funds. This is very important, and we have a little graph from the Economist Intelligence Unit showing the trend in extra allocations to the health sector post the pandemic. So our reality is that with all of this opportunity, we must, ensure that monies are spent correctly and the right investments are made so that we don't, waste the opportunity. The trend shows that allocation to health sector has improved. Subnational governments also need to step up funding for health, and this must be made clear. A lot of us we focus too much on the federal government, which is fine. But
in our remark, the technical lead, National Legislative Policy and Financing, Vivian Idogo, said the essence of the meeting was to provide finance for the national health security in Nigeria, which would help to eradicate the epidemic in the country.
Serve as the country's plan that guides epidemic preparedness, as we know, and provide the ministry the role and responsibility to advocate for increasing fund for the NAPS implementation. This meeting is one of such approach the ministry is employing to achieve financing for health security, core capacity through budget reallocation by MDAs.
While lending their voice, Tajuddin Arowolo, the rep head of Decision NCDC, and Kemisola Agbaoye, Senior Program Manager, Nigeria Health Watch, noted that the government is committed to tackling the epidemic in the country.
The releases is more than three quarter of what has been budgeted, and with the release so far, we've been able to tackle a lot of epidemic responses in the country, and we'll be able to contain a lot of epidemics.
We've had some 5 years to implement the National Action Plan for Health Security, and we are not even halfway done. So the faster we can work together to make sure that funds are allocated, budgeted, released, the activities are implemented, then the better we would be prepared.
It is hoped that significant growth in revenue generation would increase allocation to the health sector.